الحمد لله نحمده ونستعينه ونستغفره ونؤمن به ونتوكل عليه ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلل فلا هادي له ونشهد أن لا إله إلا الله وحده لا شريك له ونشهد أن سيدنا وسندنا وحبيبنا ومولانا محمدا عبده ورسوله صلى الله تبارك وتعالى عليه وعلى آله وصحبه أجمعين رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب زدني علما وارزقني فهما. My dear brothers and sisters, young and old, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another live episode of Your Health. Your Health is a program where we discuss various different health topics normally, different health topics, and we kind of give you an amalgamation of different things which may help with each condition. Alhamdulillah. Last week we were going through fibromyalgia, this kind of illness which is very, very painful. It affects ladies more than men, and it kind of, you have pain in kind of 11 of 18 different areas. And we mentioned the homeopathic remedies for that. We mentioned other kind of modalities that can help it, and we mentioned the signs and symptoms. Today, inshallah, we're going to mention two things. First of all, I'm going to speak about the prostate gland. This is more for the males, because the males have the prostate glands, not the females. I'm going to mention what is the prostate gland. I'm going to mention the illnesses of the prostate gland. To be more specific, I'm going to mention BPH, benign prostatic hyperplasia, i.e. when the prostate gland kind of increases. You'll see that, I'll mention the symptoms of it, and I'll mention what causes it, and then inshallah I will mention the treatment of this BPH, inshallah ta'ala. I'll say in English first, and then I'll go to Urdu, so please bear with me, inshallah. So first of all, what is the prostate? The prostate is a gland which is situated under the bladder. Okay, so you have the bladder right underneath your kind of belly button, and under that bladder you have a small walnut-shaped gland. Yeah, walnut. It's about that big normally. And through this gland you have the urethra. So you have the kidneys. Yeah, from the kidneys you have two ureters that kind of bring the urine down to the bladder, and from the bladder you have what's known as the urethra. That goes all the way through the prostate, and it comes out from the end of the genitalia, the male genitalia. Now, what happens? I mean, normally nothing happens all the way till about 50 years old, 55, sometimes 60. No problem. Alhamdulillah, it works fine. There's no issues. However, with certain people at the age of 50, 55, very rarely earlier, and more commonly slightly later, that prostate gland starts to get bigger. Now, when that gland gets bigger, it starts encroaching and making that urethra narrower. So, if you can go to the pictures, inshallah, you'll understand very soon how the gland looks and how it operates and why it operates the way it operates. Because if you imagine, if you have a small pipe running through a gland, and then that gland gets bigger and bigger, so as it gets bigger, it's going to tighten that small pipe that's running through. So when it tightens that pipe, initially you probably hardly feel any symptoms, but as time progresses, you will feel that the flow of urine is becoming kind of slower. First of all, it becomes slow. It's difficult for you to urinate. You find yourself getting up at night time more often. Normally, you don't get up for to go to the bathroom to pass urine at night time. When you have this BPH benign, okay, it's not cancerous, benign, prostatic, to do with the prostate, hyperplasia, an increase in the body of the prostate. So BPH, when this BPH occurs, you'll find you are waking up at night time, kind of 3, 4, 5 times at night time. And daytime, you find you're going to the toilet 5 times, 6 times. Some people go 10, 11, and 12 times. So you're going to the toilet again and again. And it's not that your bladder is always full, because when you go into the toilet, you're hardly passing anything. If you're passing a lot, then obviously you need to get checked out for diabetes and things of that nature, and you get a hormonal check. But you're going to the bathroom, and when you go into the toilet and you sit in the toilet, you're passing a small amount. So that tells you, or should tell you, that you've got an issue with the prostate. Because what the prostate is doing, and same thing if you're in a journey, you're going to a far destination, a few hours destination, you have to make frequent stops at the service stations to visit the washroom, go to the bathroom. Why? Because you feel the urge to micturate, to pass urine. But when you go to the bathroom, you're not passing much. You're passing maybe a few drops. And as it gets worse, what will happen is that you'll find them drops are very hard to come by as well. And that's kind of the end stage. That's very, very late. Even them drops are coming out very, very with difficulty. And the danger is that you can then get a kidney infection. Very, very easy. And also you may get kidney stones as well. Now, BPH is the reason for this, benign prostatic hyperplasia. The second issue of the prostate is prostatitis or prostatitis. When the actual prostate gland gets infected with staphylococcus or staphylococcus, some kind of bacteria, that's the second one. And then the third one, which happens in males, is prostaturia. All right. But the far most common one in males is BPH. And now you've got to understand this as well, that with males, the prostate is, mashallah, it's very rare that you get prostatitis. Why? Because the urethra, that pipe that comes from the bladder all the way to the end of the male genitalia, is about 6-7 inches. So by the grace of Allah, it's far removed from the bladder. In female, this is like maybe 2-3 inches. That's why females get a lot more UTIs, urinary tract infection, because it's very, very close to the exit point. And they can get infection. It's a small area to travel from there to the bladder, from bladder to the kidneys. But back to the BPH with benign prostatic hyperplasia, when that prostate gets big, if you imagine kind of an opening, yeah, when that opening gets narrower, what's happening with the bladder, when the urine comes down that urethra, it doesn't all come down, some of it stays back. And as it stays back, it becomes more turbid. There's more chances of bacterial infections or, viral infections picking up in there. And before you know it, you're full blown UTI. You have an issue. Then you have symptoms like when you're passing urine, it can become bloody. There's blood there. It's very painful. Sometimes you'll have like kind of a bit of a yellow discharge. These are all indicative of a prostate infection, which is known as prostatitis. I'm not talking about that at the moment. I want to speak about the benign prostatic hyperplasia, which is much. So most men, if you do a survey quickly around your house, most men have this problem. Some people now are having in the 40s, mid 40s, where they're going to the bathroom again and again. They're finding the flow of the urinary stream, as they call it, a lot more feeble. They go to the toilet and they find that the urine passes, there's no power, there's no force in the urine. That is indicative of prostate issues. बस मैं यही कह रहा था कि अक्सर जो यानी कि मर्द होते हैं 50 साल, 55 साल, 60 साल के उम्र के लगभग, उनको पेशाब की तकलीफ़ शुरू हो जाती है. और ये पेशाब की तकलीफ़ की वजह जो होती है, ये जो पेशाब की तकलीफ़ की वजह होती है, ये एक छोटा सा ग्लैंड जिसको प्रोस्टेट कहा जाता है, उसकी वजह से होता है. आदमी का जो पेशाब यानी कि पेशाब गाह जो होती है, जो ब्लडर होता है, तो इस ब्लडर के नीचे ही एक छोटा सा वो यानी कि ग्लैंड होता है जिसको हम कहते हैं प्रोस्टेट. छोटा सा अखरोट की तरह اتنا بڑا ہوتا ہے، اخروٹ ہی کی طرح ہوتا ہے. لیکن جب عمر بڑھتی جاتی ہے تو اس کی وجہ سے، کیونکہ وہاں کوئی انفلیمیشن نہیں ہوتی، there's no inflammatory process with this BPH, it's just because of age, there's no inflammation, it's non-inflammatory. تو وہ بڑھتا جاتا ہے، تو جب وہ بڑھتا جاتا ہے تو اس کے بیچ ہی سے، یعنی پیشاب گاہ سے لے کر آدمی کے اعلیٰ تناسل کے آخر تک، وہاں سے ایک چھوٹی سی نالی ہوتی ہے اور اس نالی سے پیشاب نکلتا ہے. تو اس نالی کے اندر جو نالی ہوتی ہے وہ سکڑ جاتی ہے. اور سکڑ کیوں جاتی ہے؟ یہ جو پروسٹیٹ گلینڈ ہوتا ہے وہ جب وہ بڑھتا جاتا ہے تو اس بڑھنے کی وجہ سے اس نالی پر زور آتا ہے، اور اس نالی، ایک قسم کی نالی، وہ پتلی ہو جاتی ہے اور تنگ ہو جاتی ہے. تو اگر یہاں یعنی اتنا ڈسٹنس ہو، پھر اتنی ہوتی جائے، اتنی جو ہوتی جائے، تو ظاہر بات ہے جو اس کے اندر جو پیشاب، یعنی جو پیشاب کا جو راستہ ہے وہ تنگ ہوگا. تو جب وہ تنگ ہوگا تو پیشاب بھی آہستہ آہستہ نکلے گا، تکلیف کے ساتھ نکلے گا، آدمی کو درد ہوگا. اور دوسری سی چوتھی بات یہ ہے کہ جب آدمی سفر کے لیے کہیں جائے یا رات کے وقت آدمی سوئے تو بار بار آدمی کو یہ احساس ہوتا ہے، ایک امپلس جاتا ہے وہاں نیچے سے پیشاب گاہ سے دماغ تک کہ آپ جائیں، آپ کے جو یعنی پیشاب گاہ ہے وہاں بہت پیشاب ہے، آپ کو پیشاب کی ضرورت ہے. تو جب آدمی جاتا ہے پیشاب کے لیے تو وہاں چند قطرے نکلتے ہیں، یا بہت یعنی کم مقدار کے اندر 250-300 ml کے جو کپاسٹی ہے بلڈر کا، اس کی بہت کم مقدار پیشاب کے وقت نکلتی ہے. تو آدمی پھر حیران ہو جاتا ہے کہ کیا ہو رہا ہے، یعنی مجھے اس طرح لگتا ہے کہ میرا جو پیشاب گاہ ہے وہاں بہت پیشاب ہے اور مجھے پیشاب کی ضرورت ہے، لیکن جب باتھ روم جاتا ہے تو وہاں بہت پیشاب کم نکلتا ہے. تو جتنا نکلتا ہے وہ نکال لیتا ہے، پھر یعنی کہ سونے کے لیے چلے جاتا ہے، یا پھر گاڑی کے اندر اگر سفر کر رہا تو گاڑی کے اندر چل جاتا ہے. پھر تقریباً آدھے گھنٹے کے بعد وہی مسئلہ ہوتا ہے. آدمی سمجھتا ہے کہ بھائی مجھے پیشاب کی ضرورت ہے، دوبارہ اگر سوا ہو تو اٹھ جاتا ہے، گاڑی کے اندر ہے تو دوبارہ یعنی سروس اسٹیشن ڈھونڈتا ہے بیچارہ. اس کو تو محسوس یہی ہوتا ہوگا کہ میرا جو پیشاب گاہ ہے وہ پھٹ رہا ہے، آئی نیڈ ٹو گو ٹو دا باتھ روم. وہ تو یہ سمجھا ہوگا، ہی فیلز دیٹ اف ہی ڈزنٹ گو ہی ول ہیو اے ایکسیڈنٹ، انکانٹیننس ایون. سو وہ چلا جاتا ہے بیچارہ. تو یہ بار بار ہوتے جاتا ہے. جن کو یہ تکلیف ہے ان کے لیے بہت مسئلہ یعنی خراب ہو جاتا ہے. رات کے وقت 4-5 مرتبہ اٹھنا، دن کے اندر 5-6 مرتبہ اٹھنا، بلکہ بعض لوگ تو 11-12 مرتبہ یعنی دن کے اندر پیشاب کو نکالنے کے لیے باتھ روم جاتے ہیں. تو یہ مسئلہ کافی نازک ہے اور کافی خطرناک ہو جاتا ہے. کیوں؟ اس کی وجہ سے بلڈر کے اندر انفیکشن بھی ہو سکتا ہے، اور پھر بلڈر کے انفیکشن کی وجہ سے جو کڈنیز ہوتے ہیں، آدمی کے جو گردے ہوتے ہیں، وہاں بھی انفیکشن ہو جاتا ہے. اور اللہ بچائے، کڈنی انفیکشن تو بہت ہی خطرناک ہے. کڈنی فنکشن بہت ہی اہم ہے. لوگوں کو جو گردے ہیں ان کا یعنی ان کی جو اہمیت ہے ان سے لوگ ناآشنا ہیں. People are not, people are aware of the importance of the kidneys, my friends. Unfortunately, the kidneys are so important. Once the EGFR level, the estimated glomerular filtration rate, falls down, you have 5 stages of kidney disease. When it comes down to the final stage, or the second to final stage, when it comes down to about 20 and 18, it's very hard. Even 27-28 kidney function is very hard to reverse. It takes years to reverse. And at that point, my friends, you will have very high BP. Why? Because high blood pressure and kidney malfunction goes hand in hand. High BP causes kidney damage, and kidney damage causes high BP, high blood pressure. So it's very important that everybody keeps an eye on their urinary tract to make sure their urine is passing, the way it should pass without any difficulties. And if there's any difficulties, a person should become alert, especially to the consequences of kidney functions, and not just kidney illnesses, but kidney stones as well. If you have a problem with your prostate and your urine is passing very slowly, it can build up and calcify, and then that can form kidney stones in the ureters. It's very dangerous. ہاں، تو میں یہی کہہ رہا تھا کہ یعنی کہ جو پروسٹیٹ ہے اس کی وجہ سے جو آدمی کو تکلیف ہوتی ہے، بار بار اٹھنا، سفر آسان کے ساتھ سفر بھی نہیں ہو پانا وغیرہ وغیرہ، تو اس کی وجہ یہ پروسٹیٹ گلینڈ ہے. تو بڑا آسان ہے. عادل, can we put these pictures on? There we are. Now if you look at these pictures, you look at the normal bladder on your left hand side. That's a normal bladder. So where it says bladder, inside there is urine. Now immediately underneath that you can see the kind of a prostate gland, like a walnut-shaped prostate gland. Through that is a small kind of a tube. That tube is the urethra. Now, normally, the bladder empties very, very easily, no problem. But if you look at the right-hand side image, which is an image of an enlarged prostate gland, look how thin the lumen is there. Look at the difference. There's two red arrows there. That's how thin the prostate gland becomes. And Zaidabat, look, can you see the flow of the urine? Instead of going down, it's going back upwards. So that causes the urine to kind of go back, and that causes issues. If you look at the second one, that'll make it more clear. If you look at the second picture, in just a moment, you'll see this in more clear definition. So there's the bladder inside, the red part's the bladder, and the left-hand side is the normal prostate gland, no problems there. The prostate gland is around the urethra, but the right-hand side picture, where you can see the prostate gland being enlarged, look what it does to the urethra. It makes it so tight, so you can imagine how much the bladder has to contract to push the urine out. A lot. It has to kind of, and the danger with that is that when it kind of, when you're doing that much contraction, it can lead to problem with the bladder, where the bladder is in a continuous state of pushing out, and then the elasticity of the bladder becomes lost. So then, no matter what happens, time can come, the urine in the bladder, you'll always have some amount of urine there, what's known as residual urine. That'll always be there. Why? Because if you look at a balloon, if you inflate it again and again and again, it becomes a bit saggy. It loses its elasticity. So that's what happens with the prostate. बस मैं यही कह रहा था कि जो आपके सामने जो नक्शा है, ये बाईं तरफ से नॉर्मल जो प्रोस्टेट होता है इस तरह दिखाई दिया जाता है. Normally, Adil, if you put that back in, please. So हाँ, तो लेफ्ट हैंड साइड का जो पिक्चर है वो नॉर्मल प्रोस्टेट है, वहाँ से पेशाब जो है आसानी के साथ नाली से आ रहा है. लेकिन दाएं जानिब जो है, जब ये प्रोस्टेट ग्लैंड जो होता है, जब ये बढ़ जाता है तो उस नाली पर दबाव डालता है, और इस दबाव की वजह से वो जो नाली है वो सुकड़ जाती है, और जब वो सुकड़ जाती है तो ज़ाहिर बात है वहाँ से पेशाब बहुत मुश्किल से निकलता है. तो जब ये हालत होती है तो फिर वही जो सिम्टम्स लक्षण जो मैंने बताए थे कि मुश्किल के साथ पेशाब का निकलना, बार बार पेशाब के लिए जाना, और जब पेशाब के लिए आदमी जाता है तो वहाँ पेशाब बहुत कम निकलता है. और यही वजह होती है ना कि ये जो प्रोस्टेट ग्लैंड होता है, ये आहिस्ता आहिस्ता यानी सिग्नल्स भेजता रहता है कि क्योंकि जब वो बढ़ गया है ना, तो इस बढ़ने की वजह से वो सिग्नल भेजता है दिमाग तक कि भाई आप यू नीड टू गो टू द बाथरूम. लेकिन हकीकत में ज़रूरत नहीं होती, लेकिन सिर्फ चूँकि ये इसके बढ़ जाने की वजह से महसूस होता है दिमाग को कि वाकई ये जो ब्लैडर है, पेशाब गाह है, वो भरा हुआ है पेशाब के साथ, तो अभी ज़रूरत है पेशाब करने की, हालांकि ज़रूरत नहीं होती. तो ये वजह होती है बार बार जाने की. ये नहीं कि ये जो पेशाब गाह है वो पेशाब से भरी हुई है, बहुत कम पेशाब होता है, 40, 50, 60 यानी मिल, बहुत कम. आम ब्लैडर की 250, 300 यानी आदमी जब पेशाब 250, 300 मिल हो जाता है तो उस वक्त आदमी को पेशाब की ज़रूरत होती है. लेकिन जिसको ये तकलीफ़ होती है प्रोस्टेट की वजह से, उनको तो सिर्फ 40-50 मिल की वजह से जब इतना ही हो तो आदमी समझता है भाई मुझे पेशाब की ज़रूरत है, क्योंकि ये प्रोस्टेट है वो वहाँ थोड़ा थोड़ा उसको छू करता है भरने की वजह से, और फिर वो दिमाग समझती है कि यू नीड टू गो टू द बाथरूम. तो ये है मसला प्रोस्टेट ग्लैंड का, और ये बहुत ही ज़्यादा आम है. Prostate issues nowadays are very, very common. Very common. And again, I'm talking about benign prostatic hyperplasia, hypertrophy. And I mentioned it's not inflammatory, there's no inflammation. There's no inflammation. It's just, what are the reasons for this? Why does this happen? It happens for four main reasons. Four main reasons why a person's prostate gets bigger. And normally, as I mentioned, it happens to people in advanced years, 50 years, 60 years, and they go to the GPs. And what do the GPs do? There's very, very limited things the GPs can do, until finally what happens is they ask you to have surgery. And these surgeries that they do are notorious for side effects. One of the most, yes, the side effects are absolutely, the critical. side effects of prostate surgery. You can become impotent. It's a normal side effect. Impotency is a normal side effect of prostatectomy, where they remove the prostate or they kind of shave it and make it smaller. It's very dangerous. However, what's happening nowadays, especially in Bradford, we've got a surgeon here, Dr. Stewart. He's got a new pioneering surgery whereby he uses steam. This is very important because this treatment that this Dr. Stewart does, he's a surgeon, a decent fellow, mashallah. What he does, it's about 3-4 years now since he's doing it. Now what he does is that he uses steam to kind of reduce the size and volume of the prostate, and mashallah, there's no, well, there's always side effects, but there's no, kind of very, very critical and dangerous and catalytic side effects like impotency, mashallah. And it's not that invasive either. I know a few people who've had this surgery done, and most of them are quite happy. Before they do it, they assess your bowel, see whether you can do this, check your bladder out, make sure you can do it, and then you go there pre-appointment. They do some scans, and then it takes about 20-25 minutes, and it's done. Alhamdulillah. So there's that alternative as well. But inshallah, after the break, I'm going to mention the 4 reasons why you have this prostate issue, and then I'm going to mention a combination remedy which is very, very effective, mashallah, for prostate issues, especially in the kind of beginning to middle stage of having this benign prostatic hyperplasia. So inshallah, please stay with us until after the break and we will go through this inshallah. बस हम अभी ब्रेक के लिए जा रहे हैं. ब्रेक के बाद हम ये जो दवाइयाँ होम्योपैथिक मेडिसिन जो हैं ब्लडर की तकलीफ के लिए, हम उनके बारे में गुफ्तगू करेंगे इंशाल्लाह. आप ज़रूर हमारे साथ रहिएगा इंशाल्लाह. जज़ाकल्लाह खैर. अस्सलामु अलैकुम व रहमतुल्लाहि व बरकातुहू.